The COVID-19 outbreak has no doubt stretched the healthcare system of many countries around the world, including Nigeria. After the index case of the virus in Nigeria was recorded on February the 27th last year, the federal government set up a presidential task force to coordinate a national response to the pandemic. For almost 1 year of coordination, the task force continued to suffer some form of resistance from citizens and subnational governments who refused to comply with the directives. The infection rate in Nigeria rises to over 143,000, with fatalities hitting over 1,700, forcing so much pressure on an already weak healthcare system. This has also weakened the response to other diseases in the country.
Nigeria's response in the fight against TB suffered a decline due to COVID-19, and a new strategy is needed to ramp up performance.
There is over-concentration of attention towards COVID-19 and ultimately with a negative impact on other aspects of service delivery. Whereas you don't have sufficient consumables to test for anemia in the laboratory, you don't have even adequate sample bottles to test for malaria, typhoid, common endemic diseases in the environment. You don't have sufficient capacity to test it, but you have supersonic molecular laboratories all around the country to test for COVID-19.
But some medical practitioners also believe that the outbreak of the coronavirus has its positive impact on the healthcare system.
For now, we are seeing more of COVID. But of course, over time, you may see some other infectious diseases. But the pattern of management is actually similar, in terms of isolating, taking to holding and then confirmation and then isolating. So COVID has actually come to make the health workforce to actually retrain on how to manage some of these cases.
Available data from the Ministry of Health and the World Health Organization reveals that diseases such as tuberculosis, Lassa fever, and malaria continue to ravage the country. According to the World Health Organization, an estimated 429,000 cases of tuberculosis is reported annually in Nigeria, resulting in about 157,000 deaths. Malaria kills an estimated 300,000 people yearly, while Lassa fever is reported to have killed at least 227 people as of October last year. Experts say that the burden of these diseases is so heavy that the response to them should not be ignored, even in the face of the COVID-19 pandemic.
We cannot completely say that we are not paying attention to those other diseases, but to me, it's just that the attention needs to be increased, particularly diseases like Lassa fever, malaria, of course, that has always been with us, and many other vaccine-preventable diseases.
The ravages of COVID-19 is obvious around the world, and the Nigerian government cannot afford to relax in its response to the deadly virus. However, experts insist that this has to be done side by side with responses to other killer diseases in the country.